Hello, everybody. I am Dr. Joydeep Ghosh. I am practicing internal medicine in Kolkata. I am attached to AMRI Mukundapur Hospital as well as I have clinic in Newtown, Apollo. So today we are going to discuss about the cholesterol management and why the cholesterol is important for us. Cholesterol, it's a very difficult thing to, digest for all the patients and common people. Because if you see that if you have a bone fracture, you get pain. If you have COVID, you have fever, you have headache. But with cholesterol, you have nothing. You almost have nothing unless there is a heart problem or there is any other problem with your uh, coagulation, with your mainly with your heart. Then you come to know that probably you are having a cholesterol problem and it's probably staying there for more than couple of decades. So later on we understood that what is the importance of management of cholesterol, why it's so important to manage your cholesterol, control your cholesterol properly. So most of the time what happens is what I would like to tell that most of the time I see my patients coming with a total cholesterol report and triglyceride report. So when we get a report like that, see, I mean, in cholesterol, total cholesterol, there are two types of cholesterol grossly. One is good cholesterol, another is bad cholesterol. So if the proportion of the good cholesterol is more, then probably also the total will be more, so that the total cholesterol will be high. If the number of the amount of the bad cholesterol is high, then also the total cholesterol will be high. So only by only looking at the total cholesterol, we are not going to come to any conclusion. So always, if you want to, go for your cholesterol check by yourself, go for a 12-hour fasting lipid profile if possible. Otherwise, going for a single total cholesterol and triglyceride level is not going to help any of us, for the patient and also the doctor, in case of treating the patient of cholesterol. Second is that if you have any heart problem, if you in your family anybody has any heart problem, if you are diabetic, if you do smoke, if you have hypertension, blood pressure problem, then just ensure that every 6 months to 1 year you are checking your cholesterol level. That's very important thing. You have to do that. And whenever it's on the higher side, if the cholesterol report, the bad cholesterol is on the higher side, you just visit a doctor. And just I suggest every time you are going to a doctor for your diabetes management or blood pressure management, right, that time you show your doctor. Most of the time the doctor asks for a fasting lipid profile, but if he forgets and if it's not done for 6 months or so, just go and ask, do the test and ask your doctor whether there is any treatment should be started or not. Second is that it's very difficult, that cholesterol, what I said earlier, that cholesterol doesn't cause any problem. So why should I go and treat a disease, a condition which is not causing direct harm to me as of now? But what we have seen that if your cholesterol is uncontrolled, if you have a bad cholesterol level which is on the higher side, or if you have a diabetic, if you are a smoker, if you are a hypertensive patient and your cholesterol is not that high but still it's on the higher side, then probably you are at risk of developing some heart diseases, some blood vessel diseases, some brain diseases, risk of stroke, risk of heart attack increases. So in such scenario, it's always better you take your cholesterol medicine after the guidance of the doctor, after getting the prescription from the doctor, if your doctor feels that you require the cholesterol medicine at that particular point. And now the most difficult part comes. I have seen a lot of patients who is coming back to me or coming to me and telling that, doctor, I was taking a cholesterol medicine before, but then I stopped by myself as I was not getting any benefit from it, or I was not understanding any benefit which I'm getting, which is obvious from the medicine. Or the second part is somebody tells me that my doctor previously told me after repeating a cholesterol, repeat cholesterol, that now your cholesterol is fine, so you can stop your medicine. No, no. Once it's started, it's for whole life, because treating the cholesterol, is all because we want to keep your heart and your brain protected. So there are two kinds of approach in treating a patient. One is you have a disease, then we treat the disease. Second is we start some medicine to prevent the disease to occur. So this cholesterol medicine is kind of a magic, because if you are really having a high cholesterol report, or the other risk factors you have for heart condition or stroke, then probably if you take the medicine lifelong, you are going to have a better heart for longer time. If you can delay the, or can stop the occurrence of stroke for yourself. So I'd always request that if once your doctor has put you on cholesterol medicine, never ever think of stopping the medicine. You have to keep it lifelong. You have to take it lifelong. I know it's difficult. It's difficult. It's very irritating at times also, because we are taking its financial burden, its pill burden. You have to take 2 3 pills per day. But yeah, at the end of the day, there are very few medicines we have which prolongs life. So it's one of them. So if you are really a candidate, when we start a patient on cholesterol medicine, and we rethink, because we know that if we start the patient on medicine, it has to continue for whole life. But when your doctor decides that you require a cholesterol medicine, please don't ignore it. Please take it. Please don't stop it without asking any advices. Sometimes people comes back that okay, I thought that I had some problem with the cholesterol medicine, that's why I stopped that medicine by myself. Unfortunately, the medicines for cholesterol which we have right now, they are very safe to use. Very few side effects. It's easy to monitor. If you have side effects, we have some other medicines which are not as good as the conventional medicines, but that can also help you to protect your heart and brain. So first thing, again, if I may repeat, that always check for total lipid profile, not total cholesterol or triglyceride level. So lipid profile is going to help us to decide that whether you require any treatment or not. Second is, if you have any risk factor for any heart diseases, like if you have diabetes, if you have blood pressure problem, if you are a smoker, if your family has a very high strong history of heart diseases and early death, then you should regularly check your cholesterol level. Fasting lipid profile should be every 6 monthly to 1 year, uh, as directed by your doctor. And if it's bad, and if your doctor tells that you require a medicine, please don't ignore the medicine, because that's going to prolong your life. It doesn't, it just prevents the disease to occur, so you won't get any immediate effect. But if you take the medicine, you are going to stay healthier, live longer. So it's very important. And I hope nowadays stress is very, huge on us. It's like the uh, job stress, it's like the social stress, it's like the medical stress because of COVID. So altogether we are totally stressed out. So in that case, if your doctor tells that okay, you require the medicine, please never ever stop, because that is very common practice I have seen among the patients, that they come and tell confidently that okay, I repeated the test after 6 months and it was normal, so I stopped. So what you have to understand that, giving a cholesterol medicine doesn't, just lowering your cholesterol doesn't won't help me. It helps in the long run to protect your heart. It protects your heart. So what we are concerned is about your heart, about your brain. We don't want any blood clot to occur in your heart or in your brain over the period of time. So we are just stopping that. We are just preventing that to happen. We are just trying to delay that. So never ever, please never ever stop the medicine. If you ever put on any cholesterol medicine, same kind like the diabetes. If you have a diabetes, if you don't take medicine, what will happen? You'll pee little more, you'll drink little water little more, you'll feel little lousy, and what else? Nothing, no. But why you are treating diabetes? Because in the long run, if you don't treat diabetes, you are going to get a lot of your organs, your heart, your brain, your eyes, your kidneys get affected. In the similar way, if you have cholesterol problem right now, if you have a bad cholesterol, higher level of bad cholesterol in your body, it won't affect you as of now. But in the long run, if you keep this for a long time, you are going to have a heart problem earlier, sooner, which we are trying to prevent. Your doctor is trying to prevent. So lot of studies has happened over a couple of decades, and we are quite confident, and it is very clear to all of us that you should never stop your medicine. What I'd suggest, what I'm repeatedly telling you in this video, in this recording, that you just follow your doctor, you continue taking your medicine, stay healthy and stay well, and live longer with a healthy heart. Thank you all. Have a great life ahead. This is Dr. Joydeep Ghosh from Kolkata. Thank you.